Okay, now we've asked Dr. Zain Chagla to join us because, Dr. Chagla, I'm wondering if you can speak to how we ever find that sweet spot between restricting and opening things up, especially, when all of our infection data is generally a week or two old from the point of exposure.
Yeah, so public health units have a huge responsibility here, and really that transparency of what's happening in local communities is what's going to drive things the most in terms of these restrictions. We know from other settings that things like restaurants and indoor fitness facilities can be at risk, but they're not necessarily in every community causing the transmission. As we see cases rising in the community, certainly the risk of that goes up. But it's important to know a community that's dealt with 50 cases from a single outbreak is going to be much different than a community where there's 50 cases that are untraced and really causing widespread community spread, where the restaurants are more at risk of having an adverse event than the outbreak. So I think communities and public health units really need to be transparent about the goalposts, and it's things like where cases are coming from, the absolute number of cases, healthcare utilization, the ability to contact trace, and the ability to get tests to turn around in a given time. And if we are getting into troubles with multiple domains, then yes, it's time to scale back, but at the same time to be transparent and say when to scale back up and when we've hit those goalposts in terms of having some success in controlling them.
Dr. Chagla, thank you so much for your time.
No problem. All the best.